Hi everyone, welcome back to the channel. So today we're going to be having a look ahead to the Diabetes UK conference, which this year, because of the pandemic, is a fully remote and virtual conference. It's going to be running from the 19th of April to the 30th of April. So it's actually an extended period. So what we're going to do today is each one of us is going to take one day of the conference and pick out our highlights. Hopefully that will be of use to you all. And something that you can use to guide you along the way. So Kevin, I'm going to hand things over to you to start off with. Day one, and obviously it had to have a session that you were talking in. So tell us about that.
Delighted to be invited to deliver one of the sessions on the opening day, 19th of April. So the session title is SGLT2 inhibitors, cardiorenal and heart failure data, but reviewed for primary care. Of course, between us, in many of our episodes, we've talked about some of the seminal data that's been published over the last 6 to 12 months. And I know we really enjoy geeking out on the data. But really what I wanted to do in this session is bring home the practicalities, how it's going to change our practice, specifically in primary care. Because as we all know, the dapagliflozin now has a heart failure license with and without type 2 diabetes, canagliflozin as a DKD license. So I'm going to go through some of these key trials, but also some of the trials that have yet to result in a license change. The Emperor Reduced trial, empagliflozin and the heart failure data, the DAPA-CKD trial, finerenone as well, etc. So it's a session I think hopefully will highlight what's been in the pipeline, what's in the pipeline, and what's going to change our practice shortly. So yeah, a 25-minute session. Be great if you can join me. But really what I was hoping to attend myself that later on was a session. It was a sponsored symposium towards the end of the day, Time in Range Revolution, to be presented by Emma Wilmot, which I'm sure many of us know well, fantastic speaker, and Scottish as well. Fantastic. So time in range is something that remains on my personal development plan with increased access to CGM. This is something my patients are asking me a lot more about. And it's something I'm going to say that I really, do need to swat up on a bit more. So I think Emma's going to take us through this relatively recently updated international consensus on time and range, talking about target glucose ranges and the time spent and the time individuals should be spending within these ranges. And this is not just people living with type 1 diabetes, this is type 2 diabetes, our frail patients as well, Amma, isn't it, to reduce the risk of hypoglycemia, and also pregnant women with type 1 diabetes as well. So all very relevant to us working in both primary and secondary care.
Amma, day two, so that's the 20th of April. What stands out for you?
Yeah, I mean, to be honest, for me, there was one particular topic that stood out, and actually it was my highlight, I think, for the overall Diabetes UK, and it was the Type 1 Disordered Eating session, T1DE. And this is a big session. It's a very emotive topic. It's something that's received a lot of coverage, actually, in the last couple of years, certainly on BBC, but also on various other means and through the government and websites. But this is looking at diabulimia, or disordered eating in type 1 diabetes, as it's called a lot of the time. And this is a session which contains 3 subtopics. So one is a very heart-wrenching story of Megan Davison from her parents, who are going to be talking about it. So that's going to be something that I'm definitely going to tune into, to listen to, and to learn about their experiences of going through this from a parent's perspective. Then there's the actual update on the study, which is called the STEADY study, the safe management of people with type 1 diabetes and eating disorders. So this is looking at addressing this condition. And then there's the Compassion for Type 1 Diabetes project, looking at a pathway for assessment and support of people who omit their insulin. So again, a very, very type 1 focused topic, but I think there's a lot to be said that this may also be something that we may see in other groups as well, and something that I perhaps don't know as much about, besides all the headlines and reading. I think getting an up-to-date information about it and what's happening and what's available, I think this will be a very important topic from my side in secondary care, certainly.
So moving on to you, Patrick, day 3.
Yes, I got the 21st. I want to just talk about 2 sessions, actually. There's one in the, if I can, So one in the evening, which is the expert debate, what is the best way to achieve type 2 diabetes remission? And you've got the weight loss by Mike Lean of Direct Study fame. You've got the low carb with Nicola Guess, and you've got the gastric bariatric surgery by Carol LaRue. So there's some fabulous speakers, and I think it's so important. I think for many of the people I treat, they've got a condition they want to get rid of. I think it's we now got PCDS, well, ABCD PCDS remission guidelines. So we know what we should do. So it's just about how you achieve it. So that I think that's great. And I think probably important with the new people who are going to be diagnosed with type 2 diabetes over this lockdown. And then I want to just, in the afternoon, there was the Joint Diabetes UK ABCD Renal Association and Kidney Research Symposium managing diabetes and kidney disease. It's, again, some great speakers, people like Andrew Frankel and Steve Bain, among others. I think just probably highlighting what excellent management of diabetic kidney disease and diabetes looks like. Not just about SGLT2 inhibitors, but looking at acute kidney injury treatment or management, and then in terms of managing lipids and hypertension. So I think really important subjects. I'm hoping to look at both of those.
Thanks for that, Patrick. So that brings us to day 4, 22nd of April. Really, the big session for me on that day is at 12:30, just after midday, reshaping diabetes services post COVID-19. We've got the big guns coming to that session. Jonathan Valabji, National Clinical Director for Diabetes and Obesity for NHS England, he'll be chairing the session. And really, this is going to be having a look at how we move forward, having learned what we have from the pandemic. And really, a lot of this stems from the very early data that was collated in NHS England, showing the association between COVID-19 mortality and diabetes, both type 1 in particular and type 2 diabetes. So this is going to be having a look at diagnosis and monitoring of diabetes going forwards. I think it's going to be really interesting because as we all move forward in both primary and secondary care, we're certainly going to be adjusting the way or continuing to adjust the way in which we manage these situations. I'm particularly looking forward to seeing how risk stratification is going to be playing its role, and also the remote consultation, perhaps what we've learned from that and how we integrate that going forwards. I know Claire Hambling, PCDS fame, will be talking about redesigning of primary care services. So that's what I'm looking forward to on day 4. And obviously, I cannot go past day 4 without mentioning that at 5 o'clock, I'll be chairing the oral presentations for the insights from real world data, which none other than Patrick Holmes of GoggleDocs fame will be presenting some excellent work, no doubt. So please do tune into that. It's going to be one of the highlights of the conference, I'm sure.
Absolutely. You've got to all listen to the results of the SURE UK real world study. So you'll be at the edge of your seats at the end of it.
Brilliant. So moving on to day 5. So the last day of the first week, so the 23rd of April. Kevin, back to you.
So a couple of sessions here piqued my interest. Getting the diagnosis right, 12:30 p.m., 1.5 hour symposium. Increasingly, isn't it? It's challenging to differentiate even between type 1 and type 2 diabetes because of the obesity epidemic partly. So often the safest strategy is to presume type 1 diabetes until proven otherwise. So this is a great session. The first session's on islet autoantibodies, who to test and what do the results mean. We tend not to have that access to that, do we, in primary care? Well, certainly not in Edinburgh, but I think it may well be something we do have access in the future to help pinpoint that diagnosis. And then
slightly ironic, Kevin, that you don't have access in Edinburgh, since some of the great work was done by Mark
Mark Strachan, yeah. So, well, in fact, the second session is delivered by Mark Strachan of the Edinburgh Diabetes Study fame, type 1 diabetes presenting in adulthood. And then the third session, pancreatic disease recognition and management, type 3C diabetes. So really interesting. And then the fourth session is atypical presentations of type 2 diabetes. So I suppose we might hear from Shivani there, maybe some post-COVID type diabetes. And then there's these past enigmas, flatbush diabetes, these other type, double diabetes. So I'm really looking forward to that. Not all diabetes is type 1 and type 2 diabetes, is it? And then very quickly, the other session that piqued my interest, and I really picked this because it's not a session I've ever really been to, diabetes and women's health. Actually, and in particularly, it was the subsection on diabetes and the menopause that I think would be most helpful to my own practice. I have a very elderly population, as you know, in North Berwick, and I've definitely seen that myself. A lot of glucose fluctuations, perimenopause and postmenopause. So maybe how I can better support these women. So really looking forward to that. Also sessions on contraception, and the menarche and its influence on metabolic dysfunction and diabetes. So I think that'll be just something a little bit different I've not really been to before. And again, particularly that session with menopause relevant to my own practice population.
You know, I think this day is for me, the day that has a number of different topics that if I wasn't there in person, I'd be running around trying to see, because there's also a bit on weight management from Ab Tirani, and there's a bit on transition care and a bit about PCNs and this new document that's coming out from the primary care networks and diabetes management. So yeah, this is the busy day for me.
Moving on to week 2, Amma, on the Monday, the 26th of April. What's piquing your interest there?
So, I mean, inadvertently, I seem to have directed towards more the kind of psychological aspects of diabetes care. So the one that I highlighted for myself was the integration of emotional and psychological support into routine care. I think it was the key bit is the integration of that support in routine care. So I think there are a couple of sessions on this. There's the Making Mental Health the Golden Thread in Diabetes Care. So evidence from Northwest London. So Amrit, you might, it's not quite your neck of the woods, is it? Probably just out.
Just nearby. North Central, but Northwest. Very close.
And the thing like, so I've asked the question now. So again, what next? So we've asked the question about, the psychological and emotional well-being, but what do we do next? So this is actually very important and something that's being built on with Diabetes UK resources and everything. So that probably is the stand-up session for the day for me. There's a little bit about online education and ethnic minorities, which was another optional one as well to look at, which I thought might be interesting. But the emotional and psychological well-being was my main topic.
And Patrick?
Yeah, 27th. Yeah, so there was just one session. I mean, there are several, but there was one session I thought was going to be useful, particularly for primary care, because it's hot topics in primary care. Part 2. So so there's a bit with David Strain kicks it off with talking about diabetes, COVID-19, and the vulnerable, frail adult, and how to manage those in primary care. So that's topical, and I think So obviously, I mean, after Amar, the leading light in terms of frailty and type 2 diabetes. But he's a bright guy and always interesting to hear what he's got to say. There's a bit about learning disability. So again, a bit like what Kevin was saying, it's something which has been on my agenda to learn a little bit more about. So it's an important area. I've got a couple of units which have people who have a learning disability living there. Managing those. And then there's a NAFLD, non-alcoholic fatty liver disease, and Dave Unwin talking about it. So that'll be interesting, actually.
Brilliant.
Going back to the frailty, though, Amrit, I was wondering, when I inevitably get type 2 diabetes because of my Asian origin and become old and frail, who would I pick to look after me? David Strain or Amar Patel?
The answer is obvious.
Kevin.
We don't even need to answer that question. The answer is so obvious. moving on to Wednesday, 28th of April, well, talking about ethnicity, something that really jumped out at me on the agenda at 12:30 till 2 is a session on the cultural adaptations in the diabetes care of different ethnic communities. And I think if there's ever been a time to shine the spotlight on specific interventions and considerations for ethnic communities, I mean, the pandemic has clearly shone a spotlight on that. So really interested to hear from some really good speakers in this session, looking at community engagement, particularly at self-care, because we know that the health-seeking behaviours in different ethnic communities can be very different. So really looking forward to that. There's also a session on champions, creating community champions, which I think is perhaps a role that is underdeveloped potentially in ethnic communities. And finally, there's a session by Joan St. John, another Londoner, who will be talking about dietary resources and the variations in ethnic minorities, but ethnic communities. But again, this is a day similar to what Amma was saying in the first week on the Friday. This is a day where I think I'd have been running around to different sessions, really topical and interesting sessions. One on circadian rhythm. We know there's a lot going on at the moment, both in the popular press and the medical press, about the effects of circadian rhythm on health and well-being. So I'd be very interested in that session, which is between 5 and 6:30 p.m. And then pregnancy again, so women's health. I think this is obviously a very important area, and perhaps an area which is sometimes not given enough attention in diabetes care. I mean, I'm talking from my own experience here in primary care at times. So I'd be interested in going to that one as well. So I think definitely a busy day for me, but it's the ethnic communities session that really jumps out to me. That takes us over back to Kevin on the Thursday. 29th.
Just coming towards the end of the conference now, two quick sessions on the 29th. I'm sure I'll be exhausted by this time. But bariatric surgery, of course, another very hot topic, primary and secondary care, but very much over the years, certainly from sessions I've been to, not everything that glitters is gold, of course. I'd love to hear some of the arguments pro and against bariatric surgery. So there's some real world results from Alex Mira. So I don't know if you remember, Patrick, he gave a really fascinating session on gut microbiota and diabetes at the PCDS conference, National One, a few years ago. Really fascinating, somewhat head scratching, really complex area. So I'm looking forward to hearing from him. And then another session on the non-surgical approaches to managing obesity and type 2 diabetes. So I presume that will bring in some of the pharmacology that we've been discussing ourselves in previous episodes. And then glucose variability following bariatric surgery. Some really impressive diabetes remission results have been observed, haven't they, post bariatric surgery, and consequently reduction in glucose variability. So it'll be really interesting to see that. And then the last session was the power of big data, 5 p.m. session chaired by Sarah Wild of Edinburgh as well. And it just be really interesting to hear from legends such as Kamlesh Kunti himself on the power of big data and how it might improve patient care and our clinical decision making in primary and secondary care, and ultimately to help improve our efficiency in primary care as well. So I think that'll be a sort of fascinating and very relevant end to the week for me.
Brilliant. And Amma, over to you to take us home on the Friday.
There we go. I think basically I should remember that for Kevin, anything that mentions Scotland, Edinburgh, that's his favourite session. So just to highlight that for everyone. So to end the day, so 30th of April, there are a couple. I could go for the obvious one, but I think it's kind of a saturation point in a way with SGLT2 inhibitors. There's a bit with looking at the cardiology take, the nephrology take, and then type 1 diabetes and SGLT2 inhibitors. That's probably something that's there in the background that might be of interest. But for me, probably I have one that's probably most interesting for me was actually, and Kevin will be happy with this, it's the Janet Kinson lecture, which is Emma Wilmot again, talking about living with diabetes and what really matters. So, talking about type 1 diabetes, what's happening, the use of technology, and look ahead as well, including closed loops and people hacking into their pumps and using kind of these kind of new technology and data to kind of improve their diabetes. So I think that'll be a really interesting thing, no less because it's Emma talking again, and you know, she's a very engaging speaker, and I learn a lot from her every time. So that's probably my highlight. Then the next bit is probably a split between the primary care small bites, which is looking at tackling inequalities in diabetes in primary care, which I think could be a very interesting topic, especially given what's been going on in the last year. And then also about prescribing in type 2 diabetes and looking at holistic approaches. So that's the one bit, but the other bit is the converse, is the secondary care side. So inpatient care, what's new? So for me, that would be the other thing, looking at the Nadia Harms audit, looking at inpatient care challenges, and looking at diabetes foot services. So, you know, primary and secondary care, that combination is probably my highlight, apart from Emma Wilmot's talk.
Brilliant, brilliant. Well, thanks a lot, guys. I think we've managed to pick out some really interesting sessions there. And I think this is really an opportunity for us to kind of really kind of immerse ourselves in a very virtual conference. So that's all from us today. We'll be interacting hopefully via social media throughout the conference. So do look out for our various posts and content on various social media platforms. But for now, that's all, and we look forward to seeing you soon. Take care, everyone. Bye-bye.
Bye-bye, everyone.
Bye-bye.